Hi everyone, this is Olga of Earth Mama Acupuncture and Herbal Medicine. I'm coming to you live from my new clinic in Montgomery Center at the Vermont Salt Cave. And I have some notes here, so occasionally I'm going to be glancing at them. But today I wanted to talk to you about joint pain and how acupuncture works for joint pain. Right now, the main joints that people come to see acupuncturists for, and in fact have the most problems with, are the main joints that we use all the time, being for shoulder, knees, and hip. Acupuncture works really well for several reasons and in several ways. First of all, acupuncture is great because it immediately works as an analgesic. It works because it helps the body to release Hi, Salt Cave. It works to help the body release chemicals that immediately go to the areas where the needles are stimulating, to decrease pain. So it has an immediate analgesic effect. In general, acupuncture is great because it works with the body's own anti-inflammatory function. And I'm going to mention that a little bit later in terms of what I do specifically in terms of anti-inflammation protocols and what that would look like. So in terms of shoulder, knees, and hips, we see that a lot just because whether you're a young person, if you are very athletic, if you're very active, obviously these are the areas that are most prone to injury as joints. Just from wear and tear, just by the nature of what we're doing. Here in Vermont, it is full-blown summertime, so everyone is outside. We're very active here. We have a lot of hiking, bicycling, swimming, fishing, walking, running, you name it. We're out here doing it. And so for people who are regularly active, these are pretty common injuries that can happen where it's in addition to just being active or a new injury like sprains and such that can happen to joints. If you're an older person and you are active or you're not that active, these are just common areas that are very prone to inflammation. So it could be from an old injury that gets reactivated, like I have that with my knee that I hurt skiing. So I'll reactivate it when I'm doing something and I'm not mindful of it, or it's just par for the course, right? We're going to be active, we're going to be outside. So we can reactivate older injuries, or if it's part of an arthritic process that you have, these are areas that are going to become inflamed from activity or lack of activity, or changes in the weather, like when it gets really humid, which it tends to get very humid up here in Vermont. So acupuncture works really good regardless of how these injuries are happening, regardless of how this pain process is taking place for you. Acupuncture works great because it does help to reduce the pain and the inflammation process. Acupuncture works best when you do it frequently and consistently, because not only is it going to address the pain when you have it, it's going to also allow the body to heal over time, so that way you have less pain. You're going to have less frequencies of pain, but also you're going to have less intensity of the pain when you do injure it or hurt it, or when it gets reactivated for weather or for whatever reason. Now, one of the ways that I work a little bit different is because in my practice, I incorporate not only a treatment plan, which a lot of practitioners do. We want you on a treatment plan, meaning we're going to schedule you and we're going to let you know exactly for your particular condition what is going to be the best approach. So whether that's we're doing acupuncture 2 to 3 times a week for 6 weeks or 8 weeks, or if we're doing it once a week for 12 weeks, that's your treatment plan. But I work a little different because I also want to incorporate a treatment protocol of things that you're doing outside of the visit with me, outside of your acupuncture treatment. Now, the treatment protocols, a lot of times, especially for joint pain, is going to incorporate an anti-inflammation protocol. Anti-inflammation protocol, I'm not going to go into too much detail about it, but it's going to incorporate foods that we want to avoid. There are foods that activate inflammatory processes in our body. And a lot of times it could be really common things that we eat that they're not necessarily unhealthy. The unhealthy foods are really obvious. Things like cold dairy, like ice cream, soft drinks, too much sugar, especially refined sugar, junk food. I mean, these are obvious. We know that these are going to have an inflammatory effect on our body. Oftentimes, as soon as you eat it, your gut gets inflamed or you start to feel sluggish. Those are all signs of inflammation in the body. So that's easy to eliminate. But there are foods that are fruits and vegetables and certain meats and things that we eat that can have an inflammatory process just because they stimulate histamine in the body. And what happens is that in this inflammatory process, inflammation is going to go to the areas of our body that already have some type of weakness. So they tend to go where we already have some type of an injury, or we have some type of a weakness. So they tend to go to these joint areas. If you have a lot of bowel issues, the histamine is really going to affect the gut. So there are certain foods that we can target. I'll name a couple. There are some citrus fruits that can stimulate histamine. Tomatoes can stimulate histamine, and everyone is different. So it doesn't mean for every single person these foods are going to work the same. But for some people, you're going to notice a difference. So part of the anti-inflammation protocol that I have most of my patients on, the first thing we're going to do is we're going to eliminate a lot of these foods for 14 to 21 days. And then we're going to start to introduce them slowly, one at a time. And you're going to see if you have a response to it. Oftentimes, in the reintroduction phase, you're going to realize, wow, I never noticed that I had an issue with spinach and tomatoes, but I just had some tomatoes and I felt this effect of it. Or I didn't feel anything, so it's not really tomatoes. Maybe it's some other foods that I'm eating. The other aspect of the anti-inflammation protocol, other than eliminating the foods that stimulate histamine and inflammation in the body, is also introducing foods that have an anti-inflammatory effect on the body. And a lot of this tends to be in the form of herbs. There's a lot of herbs that we season with and that we can cook with that actually are very anti-inflammatory. Some of the most popular ones obviously are things like turmeric, black pepper, ginger, and garlic. And we want to, and that's just to name a few because there's quite a lot. But we want to make sure that we are cooking with these and seasoning with these every day, because this is really going to help with the inflammation that we're targeting. So that's one aspect of it. Another part of the anti-inflammation protocol is becoming more active in specific types of way and making sure that you're getting treatments regularly. So I obviously want you to come in for acupuncture as frequently as is appropriate for what our goal is for you. So if you have an acute inflammation, you want to be coming in to see me 2 to 3 times a week for a certain amount of time so we can really get that under control. When it comes to joint pain, this works really well because you'll really see the pain and the inflammation come down quite a bit. And then we can start to spread out the acupuncture treatments so that we get you kind of on a maintenance. We want to maintain that inflammation down. We want to maintain the pain down. And as you start to see improvements, we can really start to space that out. I often also recommend other treatments such as chiropractic, which is really wonderful in targeting the central nervous system, also helps with that. And it works really great when you're doing acupuncture regularly. And then just trying to be active. And again, everyone is different, so I will work with you one-to-one and individually for these recommendations. But If you are someone who is somewhat active, we just want to get you active on a regular basis. So right now, where the weather is really nice, you can try to want to make sure you're walking or you're doing some type of activity every day. Nothing too strenuous because we don't want you to injure yourself. We also, on the other side of that, we want to make sure that you're getting enough rest. The body is going to work actively on fighting inflammation when you're sleeping and when you're resting. Oftentimes, when you have an acute inflammation, and that could be something like an injury, or just if you're having arthritis and you're kind of having an episode, you tend to feel kind of tired, and your body releases specific chemicals because it actually wants you to rest. It wants you to go to sleep because this is when that acute anti-inflammation activity takes place in the body. So we want to make sure that you're getting between 7 to 9 hours of sleep. 9 hours is really an ideal amount of time. I know most of us don't get that. You can see the bags under my eyes. I'm certainly not getting that. In the last couple of weeks with my new schedule and getting the kids for camp and enjoying the weather outside until it's late, but you really want to try to get closer to 8 to 9 hours of sleep as possible. Now that includes naps, so if you're able to kind of take 20 to 30 minutes out of your day and kind of close your eyes and shut down a little bit, that does go to that total amount of time. But if you're in this inflammatory state, you really do want to set aside time to make sure that you're getting rest. This is when your body is fighting inflammation. It's not going to fight it when you're working. It's not going to fight it when you're being active outside. It's going to fight it when you're in a resting state. And of course, want to make sure that you're staying hydrated. And I always tell my patients, we, in the summertime in Vermont, we really want to be outside. We want to be enjoying all that we can enjoy, but we just want to do it in balance. So of course, we want to have our treats. We have a lot of great breweries. We have a lot of great restaurants. We have a lot of great cannabis now. So we want to make sure that we're doing everything in balance. So if you want to have a special treat where you're going to have a meal that might be a little bit inflammatory, like if you want to have that pasta or if you want to have that beer, that's fine. Just, but we do it in balance. We do it, we're not going to do it in excess. And then, we'll understand that we'll probably pay for it for the next couple of days, but then we'll get back on our protocol and we'll continue to do the best we can. Now, speaking of cannabis is, in my practice, it's one of the specialties that I have, and it's one of the components of the anti-inflammation protocol that I go over with patients. So we are really blessed here in Vermont because we have a lot of great local farmers that are growing hemp, quality hemp, and that are producing a lot of great quality medicine with that in the form of CBD. And also we have a lot of people who are also growing medical cannabis, so we do have access to that. And so cannabis is an anti-inflammatory herb, and that is something that I encourage patients to incorporate into their treatment protocol as they see fit and as works best for them and as they're comfortable. So if you're able to consume CBD products or products that have medical cannabis with CBD and THC and all the other cannabinoids, that is really going to help with the anti-inflammation. And it's one of the reasons why cannabis works so well for so many illnesses and diseases, is because a lot of chronic illnesses are really a result of chronic inflammation. Chronic inflammation will lead to a disease state in the body. So cannabis is one of the medicines that I encourage people to incorporate, and we work on that together if they're not familiar with that. So what else am I supposed to say? So make an appointment with me. I'm up here in Montgomery on Wednesday evenings and Fridays throughout the day. To make an appointment, you can call me at 802-851-0604. You can email me at olga@earthmamavt.com. You can go to my website. You can comment, and we can get to see you, and we can start working on that chronic joint pain or that acute injury that you may have. I appreciate everyone here, and I'm also doing this on YouTube, which is new for me and exciting. And my son told me that I have to say, please like and subscribe and click on that bell. Thanks everyone, and I hope you have a beautiful day.